What really happens to a girl's body during puberty? The truth no one tells you. Puberty, the word itself can spark confusion, curiosity, and even fear. For many girls, it arrives like an unexpected guest, changing everything from how they look to how they feel. But what really happens inside a girl's body during this mysterious phase? Behind the scenes, a complex transformation unfolds, one that reshapes not just the body, but the brain, emotions, and identity. Breasts begin to grow, hips widen, periods start, and hormones surge like a tidal wave, leaving questions, discomfort, and sometimes embarrassment in their wake. But there's nothing shameful or strange about these changes. In fact, they're part of a beautifully orchestrated journey toward womanhood. In this video, we'll unravel the truth behind puberty, the science, the emotions, and the real-life experiences, without sugarcoating or myths. Whether you're going through it, preparing for it, or simply curious, this story reveals what textbooks often leave out. Let's take you on a journey through the real changes, step by step, with compassion, clarity, and raw honesty. The hormonal spark. What triggers puberty in girls? Puberty is often associated with visible changes like breast development or the start of menstruation, but the true beginning is far more hidden. Deep within the brain, the hypothalamus initiates the process by sending a chemical message to the pituitary gland. This signal prompts the release of two critical hormones, luteinizing hormone, LH, and follicle-stimulating hormone, FSH. These hormones travel through the bloodstream to the ovaries, prompting them to begin producing estrogen, the key hormone behind most of the changes seen during puberty in girls. This moment marks the true onset of puberty, even though the external changes may still be months or even years away. This process is called gonadarche, and it is entirely internal at first. The ovaries become more active, and the body begins laying the groundwork for physical transformation, emotional changes, and future fertility. These hormonal shifts are not random. They follow a programmed biological rhythm unique to each individual. Genetics, nutrition, stress levels, and environmental factors all influence when and how puberty begins. Some girls start as early as 8, while others may not experience noticeable changes until 13 or 14. As estrogen levels rise, they begin affecting many organs and tissues in the body. This hormone doesn't work in isolation. It influences the brain, skin, bones, fat distribution, and even the voice. Alongside estrogen, the adrenal glands release androgens, hormones typically associated with male development but present in all humans. In girls, androgens contribute to pubic and underarm hair growth, the development of sweat and oil glands, and early acne. One of the first visible signs of puberty is the development of breast buds, also known as the lark. This usually begins around age 9 to 11, but can vary widely. The breasts begin as small, tender bumps under the nipple and gradually develop into fuller breasts over several years. This is a direct result of rising estrogen levels, which stimulate breast tissue growth and fat accumulation. At the same time, many girls begin to experience a growth spurt. The long bones of the legs and arms grow rapidly, often causing awkward coordination or clumsiness. Height can increase dramatically in a short time, and this phase usually peaks around 1 year after breast development begins. Some girls may grow several inches in a single year. The hands and feet often grow first, followed by the limbs and torso. This growth is driven by a complex interaction between growth hormone and estrogen. Growth hormone, released by the pituitary gland, works in tandem with estrogen to lengthen bones and stimulate bone maturation. Interestingly, estrogen initially accelerates bone growth, but eventually causes the growth plates to fuse, marking the end of height increase. This is why girls typically stop growing earlier than boys. As puberty progresses, body composition changes. The hips begin to widen as the pelvis grows, and fat is redistributed to the thighs, hips, and buttocks. This reshaping of the body gives girls a more adult, feminine appearance. These changes are not just cosmetic. They serve a biological purpose in preparing the body for potential childbirth in adulthood. Another key milestone is the onset of menarche, or the first menstrual period. This usually occurs about 2 to 3 years after breast development begins, typically between ages 10 and 15. Before the first period, many girls notice a thin, white, or clear vaginal discharge. This is a normal sign that estrogen is thickening the vaginal lining and preparing the uterus for menstruation. The menstrual cycle is regulated by a complex interplay between estrogen and progesterone. Each month, the lining of the uterus thickens in anticipation of a fertilized egg. If no fertilization occurs, the lining is shed through the vagina in the form of menstrual blood. Menstruation can be irregular at first. Cycles may be short, long, heavy, or light. It can take months or even years for a girl's period to become regular. This irregularity is normal and reflects the body's adjustment to hormonal changes. It's also common for girls to experience premenstrual syndrome, PMS, which includes mood swings, cramps, headaches, and bloating. These symptoms are caused by fluctuations in hormone levels and can vary in intensity from one cycle to another. While all these physical changes are happening, puberty also transforms the brain. Estrogen and other hormones influence areas related to emotion, impulse control, and decision-making. This is why many girls experience heightened emotions, mood swings, and increased sensitivity during puberty. The prefrontal cortex, the brain's decision-making center, continues to mature well into the 20s. In the meantime, the emotional center of the brain, the amygdala, is highly active, often making feelings seem overwhelming or unpredictable. These brain changes are not flaws or weaknesses. They're a natural part of adolescence. They help teens develop their identity, form deeper social connections, and begin to question the world around them. However, these changes can also lead to conflicts with family, stress over appearance or popularity, and anxiety about growing up. Many girls become more self-conscious about their bodies and compare themselves to peers or media images, leading to body image issues or even eating disorders in some cases. At the same time, sweat and oil glands become more active. This is due to androgens, which increase oil production in the skin, especially on the face, chest, and back. The result can be acne, which ranges from mild blackheads to severe cystic breakouts. Proper skincare, and in some cases, medical treatment can help manage this. Increased sweating and stronger body odor also begin around this time, making deodorant and regular hygiene more important. Hair becomes thicker and may grow faster. Pubic hair appears first, often between ages 8 and 13, followed by underarm hair and eventually leg hair. Some girls may also notice a darkening or thickening of arm or facial hair, though this is usually minimal. These changes are all part of a normal hormonal progression and vary greatly in timing and amount. Emotionally, puberty can feel overwhelming. The desire for independence increases, friendships shift, and romantic interests begin to emerge. Girls may begin to explore their identity, question societal expectations, and become more aware of issues like gender roles and body image. The increase in hormones can also heighten anxiety or depression in some individuals, particularly if they face peer pressure, bullying, or family stress. Culturally, puberty can carry different meanings. In some societies, it marks a girl's readiness for marriage or motherhood, while in others, it is seen purely as a biological phase. Regardless of cultural beliefs, it's essential for girls to receive accurate information, emotional support, and open communication during this time. Misinformation, silence, or shame can lead to confusion and poor self-esteem. Education plays a vital role in shaping a girl's experience of puberty. When girls understand what's happening to their bodies, they feel empowered rather than fearful. Schools, parents, and media all have a responsibility to provide honest, respectful, and age-appropriate information. Topics like consent, reproductive health, personal boundaries, and emotional wellness should be part of the conversation, not just menstruation and hygiene. Puberty is not a single event. It's a journey that can take 5 to 7 years or more. No two paths are exactly alike. Some girls feel excited about the changes, others feel anxious or embarrassed. It's important to remind them that all feelings are valid and that there is no right timeline or way to grow up. While most girls experience puberty without medical complications, there are conditions like precocious puberty, when puberty starts too early, or delayed puberty, breast development, and body reshaping. Understanding the physical transformation. One of the most noticeable and early changes during puberty in girls is breast development, medically referred to as the larky. This marks a significant physical milestone and is often the first external sign that puberty has begun. It can be a source of excitement for some girls and anxiety or discomfort for others. Understanding the biology behind this transformation helps demystify the process and reduce fear or embarrassment. Breast development usually begins between ages 8 and 13. It starts with the formation of breast buds, small, firm lumps under the nipple area that may feel tender or sore. This stage may cause some worry if a girl doesn't realize it's normal. Often, one breast may develop faster than the other, which can be alarming, but it's completely typical. Eventually, the growth evens out. The growth is triggered by rising levels of estrogen, which stimulates the growth of milk ducts and the accumulation of fat in the breast tissue. As the years go by, progesterone joins in to help prepare the breasts for possible future breastfeeding. These hormonal effects can continue for several years, with breasts slowly increasing in size and changing in shape and fullness. It's important to understand that breast size varies greatly from person to person and is mostly determined by genetics. Some girls will have fuller breasts early in puberty, while others may experience slower or minimal growth. There is no right or wrong size or shape. Despite what media might suggest, every body develops uniquely and naturally. During this time, it's common to experience sensitivity or discomfort in the breasts, especially during certain parts of the menstrual cycle. As hormones fluctuate, breast tissue can swell or feel sore. Wearing a supportive bra, especially during sports or physical activity, can help ease this discomfort. As breasts develop, the areola, the area around the nipple, also changes. It may darken in color and become larger. These changes are again guided by hormones and are entirely normal. Some girls might also notice small bumps around the areola. These are called Montgomery glands, and they help keep the area moisturized and protected. At the same time, the overall body shape begins to change. Under the influence of estrogen, the pelvis widens, and fat begins to accumulate in the hips, thighs, and buttocks. This fat distribution gives the body a more rounded and curvier appearance, often described as a feminine shape. These changes are not only aesthetic, they serve a biological purpose in preparing the body for the possibility of pregnancy in adulthood. The waist may also begin to appear narrower compared to the hips, giving rise to the classic hourglass figure. However, it's crucial to emphasize that not every girl will develop this shape, and that's perfectly normal. Genetics, body composition, nutrition, and physical activity all influence how a body changes. As these changes occur, many girls begin to feel self-conscious about their appearance. This is often intensified by societal standards and unrealistic portrayals of the female body in media and advertising. Girls may compare their bodies to others or feel pressure to look a certain way. Some may feel they are developing too quickly, while others worry about being late bloomers. These insecurities are common, but they are rooted in false expectations and misinformation. This stage also brings about increase of one's body image, which can lead to changes in behavior. Some girls begin dieting or over-exercising in an effort to control their shape, while others may withdraw socially due to embarrassment. It's a critical time for caregivers and educators to offer reassurance, accurate information, and emotional support. Helping girls understand that all body shapes and development timelines are normal can prevent long-term issues with self-esteem and body image. Another area of change is muscle and fat distribution. Before puberty, girls and boys have similar body compositions. But once puberty begins, girls naturally develop a higher percentage of body fat. This is a healthy and expected change. The fat helps regulate hormones, supports reproductive health, and provides energy reserves. Some girls may gain weight rapidly during puberty, which can be distressing if they don't realize it's a natural part of growing up. Instead of focusing on weight, it's important to emphasize health, movement, and balanced nutrition. At this time, bones also continue to grow, especially in the pelvis, which becomes broader and more rounded. This contributes to changes in posture, balance, and gait. The skeleton matures and bone density increases, laying the foundation for a healthy adult frame. Adequate calcium, vitamin D, and physical activity are important to support bone health during this rapid growth period. Alongside skeletal growth, muscle development occurs, though it is generally less dramatic than in boys. Girls will notice more strength and coordination, especially if they are active in sports or physical play. However, because of the shift in fat distribution and hormonal changes, some may feel less confident in their athletic abilities. Encouraging girls to stay active can boost both physical and mental well-being. One more visible change is the development of hair in new areas. Pubic hair begins to appear in a triangular pattern around the genitals. It usually starts as soft and fine and becomes thicker and curlier over time. Shortly after, underarm hair begins to grow. These changes are driven by androgens, hormones produced by the adrenal glands. Hair growth patterns vary. Some girls may develop hair earlier or more thickly than others. While this is normal, it can cause embarrassment, especially if a girl feels different from her peers. Hair removal becomes a topic of interest around this time, but it should be approached carefully and with clear information. Shaving, waxing, or depilatory creams are personal choices and should never be forced or rushed by external pressure. Another significant change during puberty is the increase in skin oiliness and sweating. As the body produces more sebum, an oily substance from the sebaceous glands, acne can begin to appear. Pimples, blackheads, and whiteheads often occur on the face, chest, and back. While acne is frustrating, it's a common side effect of puberty and rarely indicates poor hygiene. In fact, overwashing or scrubbing the skin too harshly can make it worse. Simple skincare routines using gentle cleansers and non-comedogenic products can help manage mild acne. In more severe cases, dermatologists may recommend topical treatments or medications. Most importantly, girls need to understand that acne is temporary and does not define their beauty or self-worth. Sweat glands also become more active, especially in the underarms, feet, and groin area. This can lead to stronger body odor, which is often the first sign girls or their parents notice. Using deodorant or antiperspirant becomes part of daily hygiene, and regular bathing is more important than ever. With all these changes, girls may also experience increased vaginal discharge. This is a natural way for the body to keep the vagina clean and maintain a healthy environment. The discharge is usually clear or white and may change slightly throughout the menstrual cycle. It's important for girls to know that this is normal and not something to be ashamed of. However, if the discharge has a strong odor, unusual color, or causes itching, it may be a sign of infection and should be evaluated by a healthcare provider. As the body changes, so do clothing needs and personal preferences. Girls may need their first bra, may want to shave, or may start choosing outfits based on comfort, modesty, or style. The first period and the menstrual cycle, breaking the silence. One of the most significant milestones in a girl's puberty journey is the arrival of her first period, medically known as menarche. It's a moment that marks the beginning of reproductive capability, but it also brings with it questions, myths, worries, and sometimes fear. Understanding what the menstrual cycle is, how it works, and what to expect can turn a potentially confusing experience into one of empowerment and confidence. Menarche typically occurs 2 to 3 years after breast development begins, usually between the ages of 10 and 15. However, this timing varies widely depending on genetics, nutrition, body weight, and overall health. For some girls, it may come earlier or later, and both are entirely normal. Often, girls will begin to notice white or clear vaginal discharge about 6 months to a year before their first period. This is a natural sign that estrogen levels are rising and the body is preparing for menstruation. The menstrual cycle is a monthly process controlled by the intricate interplay of hormones, mainly estrogen and progesterone. Each cycle begins on the first day of a girl's period and lasts anywhere from 21 to 35 days, although it's common for cycles to be irregular during the first couple of years after menarche. Irregularity happens because the brain, ovaries, and uterus are still learning to coordinate. Here's what happens during the cycle. Days 1 to 5. Menstruation. The uterus sheds its lining, which flows out of the body through the vagina. This is what we recognize as a period. It can last anywhere from 2 to 7 days, and the amount of blood lost varies from person to person. It may be bright red, brown, or even dark and clotted. Each type is normal. Days 6 to 14. Follicular phase. After the period ends, the brain tells the ovaries to begin maturing several eggs. One of these will become dominant. Meanwhile, estrogen causes the uterine lining to thicken again in preparation for a possible pregnancy. Around day 14, ovulation. The mature egg is released from the ovary into the fallopian tube. This is called ovulation. Some girls may feel a mild pain or cramp during this time, known as Mittelschmerz. If sperm is present, the egg can be fertilized. If not, it dissolves. Days 15 to 28, luteal phase. The body produces more progesterone to support the thickened uterine lining. If the egg isn't fertilized, hormone levels drop and the cycle starts over with menstruation. The first few periods may be light, spotty, or irregular. Some girls may go months between periods at first. It can take up to 2 years for cycles to become consistent. This unpredictability is completely normal and not a sign of illness or disorder unless accompanied by other severe symptoms. It's also common for girls to experience menstrual cramps caused by the uterus contracting to shed its lining. These cramps can range from mild to severe and often affect the lower abdomen or lower back. Applying heat, exercising, staying hydrated, and over-the-counter pain relievers can help manage discomfort. If the pain is intense or debilitating, it's important to see a doctor, as conditions like endometriosis or fibroids could be involved. Along with cramps, some girls may experience premenstrual syndrome, PMS, in the days leading up to their period. Symptoms include mood swings, irritability, bloating, fatigue, breast tenderness, and cravings. PMS is driven by hormonal changes and can vary in intensity from cycle to cycle. Some girls barely notice it, while others may feel deeply affected. Keeping a menstrual diary can help track patterns and manage symptoms more effectively. A girl's first period is a major emotional event, and how it is introduced matters greatly. In many cultures, menstruation is still shrouded in silence, secrecy, or even shame. This lack of open discussion can make the experience frightening or confusing. Some girls feel embarrassed, hide their period from family, or even think something is wrong with them. That's why education and preparation are key. Ideally, girls should learn about menstruation before it starts. Parents, teachers, and caregivers should explain what to expect in simple, clear, and supportive terms. Letting girls know that periods are a natural, that healthy sign of growth can reshape the entire experience from fear to pride. In practical terms, knowing how to manage a period is just as important. There are several menstrual products available today. Pads are worn in underwear and absorb menstrual blood. They come in various sizes, thicknesses, and materials. They're often the easiest option for beginners. Tampons are inserted into the vagina to absorb blood internally. They require proper instruction for safe and comfortable use. Menstrual cups are reusable silicone or rubber cups that collect blood inside the vagina. They're eco-friendly but may be challenging for first-timers. Period underwear is specially designed to absorb blood and can be worn alone or with another product. Each option has its pros and cons, and the right choice depends on comfort, lifestyle, and personal preference. It's essential to teach girls how to use these products correctly, change them regularly, and maintain hygiene to avoid infections or discomfort. One important topic often overlooked is toxic shock syndrome, TSS, a rare but serious bacterial infection associated mostly with tampon use. To minimize the risk, tampons should be changed every 4 to 8 hours, and girls should use the lowest absorbency necessary. For many girls, menstruation can trigger strong emotions or identity shifts. Some may feel proud or more adult, while others feel embarrassed or overwhelmed. There may be confusion about how it fits into their understanding of womanhood, femininity, or even gender identity. Supporting open conversations around these topics helps create a safe space for questions and feelings. Unfortunately, period stigma still exists in many communities. Menstruating girls may be told to isolate, stop participating in religious activities, or feel dirty during their cycle. These myths are harmful and scientifically baseless. A period is not impure. It's a natural, life-sustaining process. Combating these stigmas with knowledge, empathy, and open conversation is essential for a healthier generation. It's also vital to address cultural and economic barriers. In some parts of the world, girls don't have access to affordable menstrual products, clean toilets, or even privacy during their period. This can lead to missed school days, social isolation, and long-term educational setbacks. Empowering girls includes fighting for menstrual equity. ensuring every girl has access to products, education, and dignity. Emotional support during this time cannot be overstated. The experience of menstruation connects deeply with identity, self-image, and confidence. When girls feel supported, when someone talks to them, answers their questions, and reassures them, they gain the strength to handle this new responsibility with maturity and pride. Parents and guardians play a critical role here. A father's involvement, for example, can show a daughter that her period is not taboo, embarrassing, or something to hide. When male family members treat menstruation with respect and normalcy, it sets the tone for her relationships and self-worth in the future. Schools, too, should have comprehensive puberty and reproductive health programs. These should go beyond the biology of periods and include practical management, emotional wellness, consent, and respect for diversity in how people experience gender and puberty. Education should be inclusive, shame-free, and tailored to the real questions girls have. In summary, the first period is not just a biological event. It's a powerful emotional and cultural milestone. It's the gateway to a new stage of life, filled with change, potential, and responsibility. Emotional and mental changes. Navigating the inner storm. While the physical changes of puberty are visible and often discussed, the emotional and mental transformations are just as profound, if not more so. During puberty, a girl's brain is undergoing a complete remodeling, and the result is a roller coaster of feelings, thoughts, and reactions that can be confusing and overwhelming. Understanding these changes helps girls, parents, and educators respond with empathy, patience, and support. One of the most significant changes happens in the limbic system, the part of the brain responsible for emotion, motivation, and memory. As estrogen and other hormones rise, this system becomes hyperactive. Girls begin to feel emotions more intensely than they did in childhood. A small disappointment might feel like a disaster. A compliment might feel euphoric. This emotional intensity is completely normal. It's the brain's way of adapting to hormonal changes. At the same time, the prefrontal cortex, which handles judgment, decision-making, and self-control, is still maturing. This part of the brain doesn't fully develop until the mid-20s. The imbalance between a highly emotional limbic system and a still developing rational center explains many classic teen behaviors: impulsive decisions, emotional outbursts, or difficulty handling stress. It's not about being dramatic or immature, it's about brain development. During puberty, girls often begin to develop a deeper sense of self. They start asking, "Who am I?" This is part of identity formation, a critical step in psychological growth. Girls may explore different interests, styles, friend groups, or even question their beliefs and values. It's a time of self-discovery, but it can also be a time of confusion. Some girls feel pressure to fit in, to meet expectations, or to define themselves too quickly. Alongside this, self-consciousness peaks. As the body changes, many girls become hyper-aware of their appearance. They may compare themselves to peers or to idealized images in social media and advertising. This comparison can lead to feelings of inadequacy, shame, or low self-esteem, especially if a girl feels she doesn't measure up to cultural beauty standards. This is why puberty is a critical time for body image development. Positive or negative messages girls receive during this stage can shape how they view their bodies for the rest of their lives. Comments from family, peers, or teachers, whether kind or critical, can have a lasting impact. Encouraging body acceptance and celebrating diversity in shapes, sizes, and development timelines is essential for emotional health. Puberty also triggers new social pressures. Friendships may become more intense or more complicated. Girls begin to seek deeper emotional connections, but also face challenges like gossip, exclusion, or betrayal. They may worry more about fitting in, being liked, or gaining approval. These social shifts can cause anxiety or sadness, especially if a girl feels isolated or misunderstood. In addition, romantic and sexual feelings often begin to emerge. These feelings can be confusing, exciting, or scary, especially if a girl is not prepared with honest and age-appropriate information. She may not understand why she suddenly finds herself attracted to someone or why she feels different. These emotions are a normal part of growing up, and they do not mean a girl is ready for a relationship or sexual activity. What's important is to create a safe environment where questions can be asked without judgment or fear. Hormonal changes can also affect sleep, concentration, and energy levels. Many girls experience fatigue, especially during their menstrual cycle. Some may have trouble sleeping or may feel mentally scattered. These symptoms are often dismissed as laziness or moodiness, but they are real physiological responses to puberty. Maintaining healthy routines, getting enough rest, and managing stress can help stabilize these effects. Unfortunately, puberty also brings increased vulnerability to mental health challenges, especially anxiety and depression. The World Health Organization reports that half of all mental health conditions start by age 14. Girls going through puberty are at higher risk due to the combination of hormonal changes, body image issues, social pressures, and emotional sensitivity. Warning signs can include persistent sadness, withdrawal from friends or activities, irritability, changes in eating or sleeping patterns, or a drop in school performance. It's crucial to take these signs seriously. Early support, through conversation, counseling, or medical help, can make a huge difference. This stage also introduces complex topics like sexual identity and orientation. Some girls may begin to question who they are attracted to, or whether they identify fully with the gender they were assigned at birth. These questions may emerge gradually or suddenly, and they deserve to be met with respect and openness. Every young person's journey is unique, and not all will find answers right away. What matters is providing space for exploration without pressure or stigma. Communication becomes a key tool during this period. Many girls stop confiding in their parents around puberty, turning instead to friends or the internet. While peer support is valuable, it can also expose girls to misinformation or harmful influences. This is why it's important to keep lines of communication open at home. Parents should strive to listen without reacting, validate feelings, and offer guidance without preaching. Creating a judgment-free space encourages honesty and trust. School environments also play a powerful role in emotional development. Teachers, counselors, and administrators who understand puberty's impact can support girls more effectively. Mental health education, emotional intelligence training, and anti-bullying policies are just as important as academic lessons. Girls need to know they are not alone in what they're feeling, and that help is always available. During puberty, many girls benefit from creative outlets. Art, writing, music, dance, and sports provide healthy ways to express emotions and explore identity. Journaling, in particular, helps process complex feelings and track growth. Encouraging these activities builds confidence and reduces stress. Another valuable practice is mindfulness and emotional regulation training. Teaching girls how to recognize, name, and manage their emotions can empower them through every stage of adolescence. Skills like deep breathing, grounding exercises, and emotional journaling are simple but powerful tools for self-regulation. Friendships during puberty can become both lifelines and sources of stress. Girls may form very close bonds and then experience heartbreak when those relationships shift or break. Conflict resolution, empathy, and communication skills should be part of every girl's emotional toolkit. These relationships teach valuable lessons about trust, boundaries, and forgiveness. Social media adds another layer of complexity. While it can be a place for connection and inspiration, it often distorts reality. Filters, curated posts, and unrealistic beauty standards can make girls feel inadequate. They may seek validation through likes or struggle with cyberbullying. Helping girls develop media literacy, understanding what's real and what's not, protects their mental health. Puberty also awakens a deeper sense of justice and awareness. Girls may begin to notice inequality, challenge authority, or develop strong opinions about societal issues. This emotional awakening should be encouraged. It signals critical thinking and a growing moral compass. Empowering girls to use their voices in school, at home, and in their communities helps them build self-esteem and purpose. Finally, puberty is a time for building resilience. Life becomes more complicated during adolescence, and girls need to know they can handle it. Hygiene, health, and self-care. Building lifelong habits. As girls move through puberty, their bodies begin producing more sweat, oil, and discharge, natural processes that signal the body's development. But these changes also mean that personal hygiene becomes more important than ever. Developing good hygiene and self-care routines during puberty isn't just about cleanliness. It's also about confidence, comfort, and overall health. One of the most noticeable changes is increased sweating. The apocrine sweat glands, located in the underarms, groin, and feet, become more active under the influence of androgens. Unlike the sweat from other glands, this type can mix with bacteria on the skin's surface and produce body odor. This is why many girls begin using deodorant or antiperspirant for the first time. Deodorants neutralize odor, while antiperspirants reduce sweating by blocking sweat glands. Choosing a product depends on personal comfort, skin sensitivity, and cultural preferences. Regular showering or bathing is also essential during puberty. As oil production in the skin increases, especially on the face, chest, and back, many girls start experiencing acne. Cleansing the skin with gentle, non-comedogenic, non-pore clogging products helps keep pores clear and minimize breakouts. Overwashing, however, can strip the skin of natural oils and worsen irritation, so a balanced skincare routine is key. Hair care becomes more relevant too. Scalp oiliness can increase, and some girls may need to wash their hair more frequently than before. However, washing too often can dry out the scalp and hair. Finding a schedule, whether it's every other day or twice a week, that suits the individual's hair type is important. Choosing a mild shampoo and conditioner can also help maintain healthy hair. Dental hygiene continues to be crucial. Hormonal changes during puberty can make gums more sensitive and prone to swelling or bleeding. Brushing twice a day, flossing daily, and regular dental checkups help prevent cavities, gum disease, and bad breath, all of which can affect confidence and long-term health. Menstrual hygiene is a new and essential topic during this time. Learning how to use pads, tampons, menstrual cups, or period underwear correctly is key to staying clean, dry, and comfortable. Menstrual products should be changed regularly, every 4 to 8 hours depending on flow and product type, to prevent leaks, odor, and infections. Girls should be taught how to dispose of menstrual products discreetly and hygienically, especially in school or public restrooms. Wrapping used pads or tampons in toilet paper and placing them in designated bins is standard practice. For reusable products like menstrual cups or cloth pads, washing and sanitizing properly is critical for safety. One aspect that often gets ignored is vaginal health. The vagina is self-cleaning, and using scented products, douches, or harsh soaps can disrupt its natural pH balance, leading to infections or irritation. Washing the external vulva with warm water and mild, unscented soap is sufficient. If there's any itching, unusual discharge, or strong odor, it's best to consult a healthcare provider instead of using over-the-counter treatments blindly. Shaving and hair removal become topics of interest for many girls during puberty. Some may want to remove underarm, leg, or pubic hair due to personal preference, cultural norms, or peer influence. It's important to explain that hair removal is a personal choice, not a requirement. If a girl chooses to shave, she should be taught how to do it safely. Use clean razors, shave in the direction of hair growth, and moisturize afterward to prevent irritation or ingrown hairs. Other methods, like waxing or creams, should be approached cautiously due to the risk of burns or allergic reactions. Nutritional needs also change during puberty. The body is growing quickly, and it needs more fuel. Calcium, iron, and protein are especially important. Calcium supports bone growth. Iron replenishes what's lost during menstruation, and protein builds muscle and tissue. A balanced diet with fruits, vegetables, whole grains, dairy or alternatives, and lean protein helps support healthy development. Girls who begin dieting or restricting calories out of body image concerns can seriously harm their health during this time. Not getting enough nutrients can delay puberty, weaken bones, and affect menstrual cycles. It's important to promote a healthy relationship with food, encouraging balance rather than restriction, and physical activity for strength and enjoyment rather than appearance. Hydration is another essential habit. As metabolism increases and the body produces more sweat, staying hydrated helps regulate temperature, flush toxins, and maintain skin clarity. Drinking enough water each day, especially during menstruation, can also reduce bloating and fatigue. Sleep often becomes irregular during puberty, but it remains just as important. Teenagers need about 8 to 10 hours of sleep per night, but changing circadian rhythms may cause them to stay up late and struggle to wake up in the morning. This is a biological shift, not laziness. However, lack of sleep affects mood, memory, learning, and immune function. Creating a consistent bedtime routine, avoiding screens before bed, and keeping the sleep environment dark and cool can help promote better rest. Alongside physical hygiene and nutrition, mental and emotional self-care becomes vital. Keeping a journal, meditating, spending time in nature, or talking to a trusted friend or adult are great ways to manage stress. Many girls experience intense emotions during puberty, mood swings, anxiety, self-doubt, and having a toolbox of coping strategies builds emotional resilience. This is also the age where girls are exposed to more health misinformation, especially online. Social media may offer trends or advice that are unhealthy, unsafe, or misleading. Examples include detox diets, dangerous weight loss products, or unrealistic beauty routines. Teaching critical thinking and encouraging girls to verify information from trustworthy sources, like doctors, nutritionists, or educators, helps protect their health and self-image. Routine health checkups become more important during puberty. Visiting a pediatrician or family doctor at least once a year helps track growth, development, and any emerging concerns. Girls may also start seeing a gynecologist in their mid to late teens, especially if they have menstrual issues, severe cramps, or reproductive health questions. Vaccinations like the HPV, human papillomavirus vaccine, are recommended during this time to protect against certain cancers later in life. Open conversations about vaccines, sexual health, and prevention help remove fear and stigma around these topics. Another growing need during puberty is understanding boundaries and consent. As physical and emotional changes lead to increased interest in relationships or touch, it's essential for girls to know that they have the right to say no, to express discomfort, and to expect respect in all interactions. This includes peers, family, teachers, and strangers. Consent is not just a topic for adults. It's a foundational part of health and safety for teens. Encouraging girls to trust their instincts, to speak up when something feels wrong, and to reach out for help is a form of self-care that lasts a lifetime. Knowing how to set boundaries, whether it's about physical space, time alone, or emotional needs, is just as important as brushing their teeth or changing a pad. Building self-esteem is one of the most powerful forms of healthcare during puberty. Complementing a girl's effort, creativity, kindness, or intelligence, rather than just her appearance, reinforces inner worth. Teaching her that her body is not just an object, but a powerful, capable, and valuable part of her life helps combat the toxic messages she may receive from society or peers. In this stage, role models matter. Emotional roller coaster. How puberty affects the mind and mood. Puberty isn't just a transformation of the body, it's also a revolution in the brain. As hormones flood the system, they don't just change physical appearance. They also impact mood, thoughts, and emotional responses in powerful, sometimes overwhelming ways. For many girls, this part of puberty is the most confusing and difficult to explain. One minute they feel happy and full of energy, and the next they might feel angry, tearful, or deeply insecure, often without a clear reason. But these emotional waves are not a sign of weakness. They're the result of real biological changes. The surge of estrogen and progesterone, the primary female sex hormones, directly affects the brain's neurotransmitters, especially serotonin and dopamine, which control mood, sleep, and emotional regulation. As levels of these chemicals shift, they can trigger mood swings, irritability, sadness, anxiety, or even episodes of euphoria. These feelings may come and go rapidly, making girls feel like they're not in control of their own emotions. This emotional instability can feel scary, especially when it shows up without warning. A girl might burst into tears over something minor, or feel intense anger over something that wouldn't have bothered her before. The important thing to know is that this is normal. These feelings don't mean something is wrong with her. They mean her brain is adapting to a new hormonal environment. Self-esteem and body image also take center stage during puberty. As the body changes, breasts develop, hips widen, skin breaks out, and weight redistributes, many girls start comparing themselves to others. The desire to fit in becomes stronger, and this can lead to insecurity or negative self-talk. Social media and peer pressure often make this worse, showing unrealistic beauty standards that make girls feel like they're not enough. Girls may start asking questions like, why don't I look like her? Am I developing too fast or too slow? Is something wrong with me? These doubts are common and understandable, but it's important to remind girls that everyone's body develops on its own timeline, and no two puberty journeys are exactly alike. One girl may get her period at 10, another not until 15. One may grow taller quickly, while another grows gradually over several years. This diversity is natural, not something to be ashamed of. Friendships and social dynamics often shift during puberty as well. Girls may become more aware of social hierarchies, feel left out, or worry more about what others think. Conflicts with friends can feel more intense, and the desire to be liked or accepted can dominate thoughts. Sometimes, friendships that once felt solid may break apart while new ones form. This is all part of growing up, but it can be emotionally exhausting. At the same time, girls start to form their identity, figuring out who they are, what they believe, and how they want to be seen in the world. They might explore new interests, question old routines, or experiment with different styles and ideas. This process is healthy, even if it seems confusing. It's how young people begin to separate from childhood and move toward independence. Romantic feelings and attraction may also begin during puberty. Some girls may develop crushes, start dating, or think more about relationships. Others may feel uninterested or confused about their feelings, which is also completely normal. Puberty doesn't come with a manual, and everyone experiences emotional development in their own way. These early experiences with attraction often raise questions about sexuality and identity. Some girls may realize they're attracted to the opposite sex, the same sex, or both. Or they may not feel romantic attraction at all. Others may question their gender identity, wondering if the gender they were assigned at birth matches how they truly feel inside. These are deep, personal questions that can take time to explore. Parents and caregivers can play a powerful role during this stage. Open communication without judgment or pressure helps girls feel safe asking hard questions. Simply listening, without trying to fix or rush things, can be incredibly supportive. Even when a girl pushes away or claims she doesn't want help, she still needs reassurance that she's loved and accepted. Some girls may experience mental health challenges during puberty, such as depression, anxiety, or eating disorders. These are not signs of weakness, and they're not things that can be solved with willpower or cheering up. They are real conditions that may require professional help from a counselor, psychologist, or doctor. Warning signs to watch for include extreme mood swings or prolonged sadness, withdrawal from friends or activities, obsessive thoughts about food, weight, or appearance, changes in sleep or appetite, self-harm or talk of hopelessness. Early support and understanding can make a big difference. Mental health is just as important as physical health during puberty, and getting help early can prevent long-term problems. Girls can also be encouraged to develop emotional tools that help them navigate the ups and downs of puberty. These include journaling. Writing down thoughts and feelings helps girls process emotions and track patterns. Talking. Sharing with a trusted friend, sibling, teacher, or therapist can relieve stress. Breathing exercises or mindfulness. These techniques calm the nervous system and reduce anxiety. Creative expression. Drawing, music, dance, or writing can give girls a way to express feelings without words. Movement and exercise. Physical activity releases endorphins, which improve mood and reduce tension. Another important aspect is setting boundaries and learning to say no. As girls become more independent, they may face pressure from peers, romantic interests, or media to do things they're not comfortable with. Whether it's being touched, sharing private information, or participating in risky behavior, girls have the right to set limits and protect their space. Teaching girls about consent and assertive communication is essential. They should know that their feelings are valid, and they don't have to explain or apologize for their boundaries. Saying no doesn't make them rude or weak. It makes them strong and self-aware. Digital boundaries are also critical during puberty. Social media, messaging apps, and online platforms can create environments where girls feel pressure to look or act a certain way. They may encounter bullying, inappropriate messages, or unrealistic comparisons. Learning how to navigate online spaces safely by using privacy settings, blocking harmful content, and taking breaks from screens empowers girls to protect their mental health. In schools and communities, support systems can make a big difference. Teachers, school counselors, coaches, and youth mentors who understand the emotional landscape of puberty can help girls feel seen, respected, and heard. Safe spaces, whether in classrooms, after-school programs, or clubs, allow girls to explore identity, emotions, and self-worth without fear of judgment. Finally, girls should be taught to embrace self-compassion. Puberty is a messy, non-linear journey. There will be awkward moments, embarrassing stories, and days when everything feels wrong. But with kindness toward themselves, girls can begin to trust that they're not alone, that growth takes time, and that every part of their journey is worth honoring. In the end, puberty isn't just about growing a new body. It's about growing into a new sense of self. The emotional changes that seem chaotic or difficult are actually signs that the mind is evolving, gaining depth, strength, and resilience. When girls understand and accept their emotional changes, they're not just surviving puberty, they're beginning to own it, to shape it, and to rise through it with courage. Puberty is not a curse, a mystery to fear, or a race to finish. It's a powerful transformation, unique to every girl, marking the beginning of strength, self-discovery, and womanhood. Embrace it, understand it, and know that every change is a step toward becoming the incredible woman you're meant to be.